Thank you for inviting me to meet your champions group from the local area. My name's Robin Lansman. I'm an osteopath, and I've been an osteopath for 32 years. And the topic's a very interesting one because it comes up now and again, certainly in practice. I'm based at Maida Vale Library in W9, which I think is Westbourne Ward, if I'm not mistaken, just on the edge of Maida Vale and Little Venice. And so I had a room here for a couple of years. I've been in practice a long time, but we wanted to get a little bit more community connected, and it's been a very interesting connection working at the library, having a room here. Obviously, we work as a private practice, but we do lots of other outreach activities for the library and your group as well, for children, for older people, and help desk that we've run actually in Church Street, Paddington, and Maida Vale Library actually over the last couple of years or so. So the topic, I don't want to really give a lecture so much. I've got a list of questions, and osteoporosis is an interesting topic because it comes into my mind because we need to take care, first of all, to diagnose it, to check if someone coming to us with back pain or other pain actually is safe to treat. So one of the main reasons that an osteopath like myself is interested in osteoporosis, apart from the topic, is to know that people are safe to treat if they come to us after an injury or they're suffering pain, and we need to check the reasons behind that pain carefully. And we do that always with a case history and examination to assess them first before we put hands on or do anything. And obviously we want to adjust our treatment to be appropriate for the case and safe for the case. I mean, that's always got to be what we're doing and how we're working. So I mean, I can go through some of the questions, I think possibly. I mean, what I wanted to highlight, I was looking up some bits and pieces that might be useful resources. For example, the Royal Osteoporosis Society might be something, again, Kimberly might ping out, I think I sent it to her, a link to that, because they've got lots and lots of detailed information. But again, it's about individuals that often is sometimes missed in the broader information. And, you know, as an osteopath, we try and look at individuals rather than do broad spectrum care. It's always taking into all the different reasons someone might have a problem, rather than just kind of isolating things as separate entities. Am I speaking too fast for anyone, or people are following, hopefully, you know what I'm saying? It's always hard to gauge when you can't see people's faces doing a Zoom meeting. So do let me know. Or let Kimberly know. The other part then perhaps to look at is that osteoporosis itself is quite common to lots of different backgrounds and can affect women in particular ways for hormonal change reasons as well. And it can also affect people who've had other underlying illness, treatment, chemotherapy, other types of therapy, where that might actually be a side effect, if you like, of the treatment that they're receiving. It actually really is a little confusing because there's a condition which is called osteopenia, which means that actually you have too few active bone-making cells. But osteoporosis is when the density of the bone itself drops. Now, it varies from person to person as well as to where it can affect them. And I think that's a point to note, because the factors in itself, it doesn't necessarily produce pain. It may not be very obvious even you've got it, but what it can produce is a risk of, for example, falling and fracturing bones that have become weak over time. And it's a slow process that you just don't really see coming until there's an accident or a fall or an injury, when your break or your fracture is suddenly a lot worse and more painful than you might expect it to be for what actually happened. So that's a prevention thing to get checked and to look at that. And there's a number of different checks that people have, where they have bone density scans, Dexa scans, where people can actually have their body checked. Traditionally, in the past, the less thorough check, I suppose, is looking at the big toe joint or looking at the ankle to kind of just give a rough idea about what's going on across the rest of the body in terms of bone density. But the Dexa scan, this kind of more detailed thing, actually looks at the spine, and it can look also at the hip area as well, because the hip is obviously a common area that can get fractured in a fall or slipping. So when we think about this time of the year, you know, with leaves and that time of year when it gets a bit more slippery and a bit more perhaps difficult to get about, then you're trying to keep fit, you're kind of trying to do exercise, but obviously slipping in those circumstances with any osteoporosis could be a much higher risk situation. So the causes, as I've said, I mean, it does vary considerably, but diet has something to do with it to some of the time. And actually, even in fact, the absorption of vitamin D through sunlight can be diminished over years. And vitamin D is an intrinsic part of bone health. So people with darker skin living in England, where the weather may not be as sunny as it might be, might mean that the synthesis of vitamin D, that production, is reduced. And a lot of people do have low vitamin D levels when they're actually checked at the GP. So it's kind of something that, you know, doesn't cost a lot to do and is a fairly simple check. And in fact, I went about 3 or 4 years ago, even myself, with no risk of osteoporosis particularly, but had my vitamin D checked, and it was really, really much lower than even I expected. And so I was put on vitamin D, which I take. So it's a strange thing that these things can creep up on you, and awareness really is a big part of what this is all about. So I think partly there are treatments such as taking calcium supplements, and some people might be on hormone replacement therapy, but that has other risks and other areas to be concerned about as well. So so the absorption part is also another part of your digestive tract. So taking supplements that don't go through your stomach lining for various reasons can actually mean, although you're taking the pills and the extra supplements, they're not going in to your system. So that's something that needs rechecking to check that actually it's being effective, because it seems like it should help you, but perhaps sometimes it isn't. And it's not about taking more of it, it's just about getting it to be absorbed better. So one of the things that is interesting is actually, and there are various fruit juices that have vitamin D added, for example, calcium added, and vitamin C actually helps the absorption of some of these other minerals into your body. So sometimes it's what you take with things that actually makes it all work better. So, I mean, yeah, there's a number of areas I think that perhaps we've mentioned the hip, which can be a problem because obviously a weakened hip could lead to a fracture and lead to damage. But in fact, age group wise, it can start slowly, and obviously the risk of falling might increase with age and becoming a little less steady anyway. So that then could cause that risk of a fracture. And the thing about a hip fracture is there's a big blood loss involved. That's the problem, partly, apart from the disability that might come. So that's an area where, you know, that can be really a big stress on your system. Talking about the vertebrae, I'll just put up a picture. In fact, the vertebral bodies themselves and some of the spinal joints can be affected by osteoporosis. And so sometimes people, if they literally, I don't know, misplace sitting down on something and fall and bang their bottoms on the ground, they can actually cause a little bit of a fracture in some parts of the vertebra, a mild fracture, but it can still cause a problem. And in the worst cases, the vertebral body, that's the bit that literally your spine piles one up on top of the other to form the whole spine. They actually can be weakened again with osteoporosis in the lumbar spine or the thoracic upper spine. And again, they can collapse. I mean, in the worst case, and that can actually cause compression of the nerves. So if you can see some of the nerves here emerging, and this is obviously a plastic model, but where these nerves come out is a sensitive area anyway. And if that compression occurs, then that can cause a problem. Now, when people come to see me for treatment, they might have back pain. And many people come to me with back pain and hip pain and sciatica and so on. That's a very common presentation to see me. But obviously we need to see if there's been any trauma or anything, as in an accident or other thing that may contribute to this compression that's going on. It may not be osteoporosis, but we've got to take it into account in the case history and the background story to that individual. So we might ask things about their diet and whether they're aware of certain things about, you know, whether they drink milk or cheese products or they don't. Some diets don't, and some people don't tolerate it for other reasons. So it means they might be missing out on certain minerals. Now, vitamin D I've mentioned, and vitamin C and calcium supplements are all useful. So to say, I think I had a question, is it reversible? Well, the thing is, doing good exercise. Wait, sorry, does someone have a question?
Calcium. Vitamin C, vitamin D, and calcium.
Yeah. they're the typical minerals. I mean, everything goes together to help make a healthy body, but they're the typical aspects that are worth looking into in terms of the basics you can get from a chemist over the counter without, you know, having to get a prescription. Calcium, generally, you've got to be a little careful of, because if you take more and more calcium, it can cause other deposits in your body and cause trouble with your gallbladder and your kidney and other parts of your body and even your muscles. So you've got to be a little careful just adding supplements willy-nilly, but speaking to your doctor or nurse or even osteopath, that's the kind of conversations that we'd be having. And perhaps sometimes a practice nurse is a very good person to talk to for advice, because they can go through those things with you as well.
Okay.
So one of the questions came up about slowing it down, as I just mentioned. And so doing exercise is seen to be good because weight-bearing exercise, as in walking or running or anything of that sort, stimulates the bones to produce more bone. It makes them stronger. There are little electrical currents when you squeeze bones or they get pressure on them that stimulates the bone cells to produce more bone. And it's a natural event, and it basically is the body telling your bones you need a bit more strength and you need to support yourself more, so that stimulates bone growth, which is good. And the problem is walking on its own does stimulate the hips, the legs and the spine to a point, not very high up the spine, but if you look at this model, probably you know, up to about here you might get a benefit from walking. And again, your hips and legs may benefit. But the problem is, if you're doing all that exercise but you haven't got the right minerals in your body, unfortunately that will mean that you're still not making enough new bone because you haven't got the material to build the bone with. So some of these things, you know, you can't do one thing in isolation. It's very much a matter of doing a combination effort, and being aware of the different aspects and working with those to try and get some strength. So when people come to me in pain, they often come because they want to do exercise, or they're frustrated because their bodies are giving them pain, and for other reasons, nothing to do with osteoporosis. But if you can't actually exercise, if you can't walk and you can't do exercise properly, then just because your knee is a bit painful, your ankle's painful, your back's painful, then obviously that doesn't help you build stronger bone. So that's a reason also for getting perhaps treatment for other things to make sure you can maintain your activity levels, and that's really, really important. So slowing it down and taking vitamins, these are all things that you can do, but there are cases where, for example, when you've got thyroid disease and you've had, as we mentioned earlier, you may have had chemotherapy and things, that this will challenge the way your bone is reacting and growing and developing. So these need to be looked at separately in a bit more detail, because that's not an easy fix necessarily, and needs perhaps more of the doctor's intervention to help you move
that
forward.
one is my question. Is that okay? Can I ask a question, please?
Yeah.
I am in receiving chemo. I just finished it now. And you said osteoporosis affect the bones. So when you said, how do we know? Do you say it affects the hips first with the chemo? Does it affect the hip as well, or all the bones? We don't know exactly where.
Has someone got a radio on or TV on? Because it's very hard to hear. I'm not sure, but if they're able to turn off the TV or radio, it'd be really helpful. Or turn off their microphone, that would work even better, if that's okay. Sorry, can you say the question again?
Yes, I'm receiving chemotherapy. You said osteoporosis people, the places that's most affected is the hips, or usually.
Sorry, it doesn't necessarily. Osteoporosis wouldn't necessarily just affect the hips. It could affect the spine, the ribs, and other bones. It's not necessarily just the hips.
Mm-hmm. I understand. For people, when they have, so definitely they can have osteoporosis, isn't it, because of the treatments?
Well, there is a risk from having chemotherapy in getting osteoporosis, and also some people, perhaps because they're recovering and don't feel like it, they don't possibly exercise as much as they used to. So, I mean, the latest, as much as you can as well.
It's very hard.
I mean, it's hard. It's very hard.
Mm-hmm.
But actually, the mental benefits of exercise as well, and getting, you know, a little bit of fresh air and getting some exercise could actually make you feel, you know, better in that sense. And I'm not saying it's a cure, but it might actually help you cope better. It's a coping strategy, but the exercise in itself can actually help with the osteoporosis. And obviously dietary supplements and eating a healthy diet, like always, is as much as you can, is going to stimulate the body to do whatever it can to feel healthier and fitter. And osteoporosis, definitely, even if, you know, there may be some cases where you can't get as much sunlight because of the treatment you're having as well. And that might mean that, for example, vitamin D supplement might be an option, you know, which at least you could take and still not be in sunlight as much. So, you know, it's trying to find a way around things and try and be proactive, I think, is the key.
I do. Just the thing is so differently the cancer treatments causes the osteoporosis. That's what I'm trying to get to. So
yeah, and it might in different. No, I understand. In different people, they may already have underlying issues that might be a little bit osteoporosis before they even set out with cancer or the treatment. So how it affects people, this is why it's not one fix for everybody, that everybody gets a hip problem or everybody gets a spinal problem. It can be different in different people in different ways. And I think it's just to be aware of that. I mean, ribs are risky because obviously they're, you know, where they are in the body. Hips are a little bit risky as well. And spinal joints, you know, on the whole, you know, I mean, people don't traumatize their spines too often, but if they do fall or move badly and it's very weak, the bone, and brittle, then obviously there is a risk there they could trap nerves and cause other damage, which is going to be more painful.
Thank you very much.
Yeah, it's a pleasure. Yeah. Is there anyone that has another question as well?
I just want to ask you, because of the menopause, after you develop menopause, obviously you have to make sure, like you said, you can develop slowly osteoporosis. You were talking about like the proper diet and so on, and cheese is one of the source of calcium. Unfortunately, I am originally French, and we eat a lot of cheese, and I was told to stop the cheese because of cholesterol. Right. I can develop higher cholesterol. So now, if I have stopped cheese, what is it? Do I need to take like calcium tablets or something supplement to replace?
Well, the calcium level in certain orange juices, I won't mention mates, but they have calcium added. Other skimmed or lower fat milks have calcium in the same way, and indeed cottage cheese and lower fat cheeses, which are low cholesterol, also have the calcium. So you can get calcium in cheese, but doesn't have to be, say, the unhealthy or fatty cheeses.
What about soya sauce, soya milk?
Well, some people do feel that certain other types of supplements or replacements for other things do have. Some of them even have it added as a supplement. You know, they actually, you might buy one where it's got added calcium or added minerals. I mean, some of the breakfast cereals, for example, cornflakes, you know, actually has got, a number of them have other minerals and vitamins added to those products. So, I mean, you know, there are a number of ways, you know, of finding other ways to get that sort of diet input without having to necessarily, you know, take the pills. But you need to speak to the doctor, because, as I said, taking organs and other systems, so you need to be a little careful just taking extra calcium per se. You know, that's the point. It sometimes has adverse effects on people's bodies in different ways, and you need to be aware of that as well. You know? So unfortunately, it's not always like one size fits all. That's the point. Not with these things. That's why we like. I mean, this is why it's an interesting topic, because it's got a number of different areas to explore and think about. Yeah.
Yeah. Thank you.
I hope that helps. Yeah.
Thank you.
Does anyone else have any other questions or? Ah, right, okay. Do ask questions. Kimberly said, yeah. So you're welcome to.
Yeah, is it me? My turn?
Hello.
Hi. Hi, my name is Kyra. I didn't introduce myself earlier. Yes, I came 5 minutes or 6 minutes late. Yeah. Nice to hear what for the meeting. Thank you. My question is, if for how long we have to take the vitamin D? It is not affecting.
The vitamin D, well.
Yeah.
No, it takes some months to build up in your system. Yeah, so you won't see an instant change. And again, many people are on vitamin D constantly. I mean, they take a small dose, but they just keep taking it. So it might be something, you know, at the different times of year. Some people, if there's more sun or they get more sun on their bodies, they take less, but in the winter they take more. So it all depends on your lifestyle. I mean, a lot of these pieces of advice are about, you know, what you want to do, what you can do, about your lifestyle and background. And so, you know, that idea about taking vitamin D at the right level is important. Taking too much vitamin D is toxic and not good for your body. So, you know, you've got to balance that and speak to the nurse or the practice doctor or the pharmacist. I mean, to talk to a pharmacist about this, you know, you can get a lower level supplement that you just take daily. So that's perfectly possible. I mean, certain things like oily fish, you know, and lots of other things you can eat in your diet also have other vitamins or minerals in. So it's not always about supplements. I mean, really isn't. The key part is your body absorbing it? And that's what you then check, having a test some months down the line to see whether your body is absorbing the vitamin D in terms of, has your osteoporosis got any better? Yeah, have you changed your situation with calcium and vitamin D supplements? But again, I'm an osteopath. I don't push supplements. I'm aware of osteoporosis and the way it affects me in practice and what my patients ask me. So again, if you're not sure and you think you really want to check it out, I mean, pharmacists are a source of information. So to speak to the proper, you know, registered pharmacist behind the counter, rather than just the person serving, to actually speak to the pharmacist might be something you could also do to check, you know, something more on that topic.
And what is the average amount you think it is better to take it for the vitamin D? I mean, it's not going to be harmed of, you know?
No, you have to take quite a bit to do that. And so what they sell in a shop in a normal size capsule that you would take daily will be regulated to be a reasonable amount for your body. You know, so that's not going to be, you know, that's not, and ask the pharmacist about that. But I mean, obviously, if you're suddenly worried, for example, like anything, that you've got osteoporosis and you start taking a larger amount of these capsules more than perhaps it recommends, then of course that's always going to be a risk. So you've got to read the instructions and keep on track. But again, your doctor would measure how low your vitamin D level is and then indicate by prescription the level that would be most appropriate for you. Because buying it over the counter tends to be a lower level, and buying it, you know, from or getting it through your doctor would be a more, can I say, accurate way to work out exactly the dose you need and what's the most appropriate for you.
Yeah.
All right.
Does that
Thank you.
help? Yeah.
I get a question, please. Also, yeah, I get a question.
Yeah. Hello.
Hello. Actually, I get a rheumatoid arthritis a long time, and I'm still, you know, affecting me badly. I'm taking methotrexate. Did that mean in the future maybe I will develop osteoporosis or not?
Well, I can't guarantee it because everyone reacts differently to different drugs in different ways. But if you're staying mobile, and that could be a problem, if the methotrexate is helping you manage your symptoms and you're able to do more exercise and walk and do more exercise generally, that's going to help you. And as long as you're looking at your diet and so on, again, that's going to help you. So you've got to do whatever you can. And the reason for taking tablets, apart from relieving the pain, is to get you more mobile and get you more active. So that's if that's happening with the tablets and they're working for you, the methotrexate, then you know that's good news, and at least managing to keep you healthy in general terms, and including your bone density. So again, the interface with some of the drugs on your health and on your body could be a factor. And if again you're concerned, you'll be checked, I'm sure, by the doctor or by the practice nurse, perhaps, just to check whether there's any longer term issues for you personally from taking a particular medication.
Actually, it's now 12 years, and every time they increase it. But my mobility, they told me when you're getting older, that means you are not, you know, the medication is not working, but my mobility, it gets worse. But my concern is that affect my joints, and maybe my bones get osteoporosis or not.
Yes.
Listen, I mean, this is making it a very individual consultation without any of the full information. So I can't explore it fully with you. All I can say is, if you're concerned and you've been on the tablets for a long time, then maybe you need to see a rheumatologist through your doctor and get a review. Maybe you need to look at the bone density and have a review, and discuss also any blood tests just to see how your general health is with your doctor. I mean, this is something, you know, now and again you probably should be doing if you're on long-term medication. So I can't answer more specifically than that, really.
Okay. Thank you.
That's
Thank
okay.
you.
Hi, can I ask a question, please?
Sure.
What are the first signs of osteoporosis?
Well, again, like with all these things, they're going to be different with everybody. You may not feel any pain at all. And the first sign someone knows they've got osteoporosis is when they've fallen over and they've actually hurt themselves. And when they x-ray, they realize the bone density is low. So it could literally be some broken ribs. It could be a fractured hip. It could be a spinal fracture, a small one, a chip, or a sort of compression. And so, you know, it may not be everybody spotted early enough. And it's possible that people at risk because of their general health maybe should be seeing their doctor, seeing their practice nurse, and checking their bone density, even on a basic level, and checking their mineralization. So to go and get your blood test to see, you know, really what your status of blood health is, to see what's going on and what you might need to take as a supplement. At least that would start the process off to think, I need to look into this. I don't want to tell everybody to go and, you know, see the doctor tomorrow and get a blood test or whatever, or even to start taking vitamin D, but, you know, you may not feel symptoms. So it's not always possible to say that that would be the first thing you'd notice. But people at risk because of low exercise, they may suspect their diet isn't very good, or they're on other medication or underlying other health issues, are more at risk and therefore might be worth having a check.
Thank you.
Yeah. Hello?
Yeah. I've been taking vitamin D for years now, and every time I check my vitamin D level, it's just below average, way below average, even with taking the medicine. And you said exercising will be like useful to build up, to make the body build up more bones. But with my case, exercising is all right, but running, I always have like a burning feeling in my ankles. And I've been to my GP, I told him that I feel when I run or even like quick walk, I feel a bit burning feeling. And I told him that you won't feel anything if you have it. Like, I don't know if it can be sign or...
It's not necessarily a sign of osteoporosis that you've got this burning feeling in your shins or your ankles. It might be you have very stiff feet. It might be a lot of other things that we can't go into individually. And that would be a case, you know, you might be a case that actually sees someone like myself and goes through it and looks at it individually and says, well, look, what's going on with your ankle mechanics and your foot mechanics? And maybe it has nothing to do with the rest. In other words, it is a problem. It's preventing you exercising properly, but you know, they may not be connected to other issues. Your vitamin D levels being a bit below average may be okay, but again, it depends whether calcium levels and bone density and other things are an issue or not. And also, perhaps, you know, look at the dose, whether the dose is appropriate or whether you need to eat more vitamin D within your diet, maybe, instead of taking more supplements. I mean, it could be that. And you can get it reviewed again in 3 or 5 months' time and see whether it's improved. I think the thing with and we're talking about vitamin D a lot, but the thing with vitamin D, it has lots of different effects on the body. Not everybody's even 100% sure what it does entirely for every part of the body, but when you haven't got it, people tend to suffer, and particularly with bones is one example, but skin health and muscle health and all sorts of other structures of the body become affected when you lose, for example, vitamin D. So it is an important one to get checked and to get it monitored and maybe look at the dosage.
Yeah.
But what I'm saying is, because you have osteoporosis, don't blame every ache and pain on the ankles or everything else as being to do with osteoporosis, because it would be the same having, you know, cancer or any other illness. You can't blame everything on the one big worrying thing that gets on your mind, because otherwise that stops you doing all other forms of exercise, and maybe you need to investigate it in a different way. And often if you go to a busy doctor and they look at you and you think, well, we're dealing with the big issue, and yes, your ankles or other bit of you is causing trouble, but that might be slightly put to one side because they're more worried about the bigger health issue. But in the end, not being able to exercise does have a negative effect on your health and mind and body. So,
yeah.
Can I ask a question?
Sorry, go on.
Yeah, I want to ask, there is a link between fibromyalgia and osteoporosis, or the fibromyalgia link with muscles and nerve, or all of them is a link with the bones?
Well, they can go together, but fibromyalgia can be is a condition affecting the muscles in particular areas of the body, or generally, and it's a sensitivity and a tenderness in the muscles, and a sort of almost an unwillingness for the muscles to wake up and be too active. Now, it can come from all different reasons. It can come from emotional stress. It can come as a side effect of being immobile for too long, perhaps of being on certain types of medication. And fibromyalgia directly as a connection, I'm just trying to think if I can think of a connection with that and osteoporosis. I'm not sure there is one. I mean, lack of activity can come from both, or the cause of lack of activity can cause things to contract and stiffen. And indeed, it makes it much harder for you to deal with stress and tension if you're not exercising, which builds up that sort of cycle where fibromyalgia pain can be a problem. Now, it's something medically that doctors struggle with and treat in different ways, but certainly as an osteopath, we look at exercising it and stimulating the muscles and loosening the joints to actually make more mobility in areas where you're suffering in terms of the fibromyalgia. And so, yeah, that's the approach I would take. But I can't necessarily say they go completely together, the two conditions that you asked about.
Because sometimes the pain in the joints, you can really understand it's come from the muscle or a nerve or the bones. Yeah, I feel like there is a pain in the bone, but you can understand it. What exactly link with what? The muscles, the joint.
When you see someone, I mean, we're specialists in musculoskeletal problems like you're talking about. Now, when you describe things, everybody's got a different way of using words and a different way of describing their symptoms. So what we need to do is do a case history, explore it in detail, and then ask some questions, then do an examination to see what I would say correlates, you know, what hangs together in terms of what's the cause and effect of different issues. And that's the way I would approach it, because sometimes it's overwhelming, the emotional response to being in pain and how you perhaps feel and perceive things to be in the bone or in the muscle, and because it's a nerve, definitely. And people will come to me and say, I've definitely got a nerve pain, I've definitely got this, or I've definitely got that. But when we examine them and go through it, I would probably say 9 times out of 10, it's not quite what they thought it was. So that's my experience as an osteopath for 32 years. That's what I see.
Thank you.
So,
thank you.
Yeah, pleasure. No, it's okay.
I have one question.
Sure.
How we know if our children had osteostasis? Because a lot of parents, they discover it very late after their children like fallen down and broken hand. So how we know if our children had it?
Well,
is
on
any
the whole,
symptom for the children or anything?
Well, osteoporosis in children is not a particularly common thing, but it could be connected to other illness and other medication. Now, and it can be in the extreme where there's some malabsorption going on in the body, where perhaps their body is not taking in certain minerals. So this is something that is quite a detailed answer that needs investigating fully to see, you know, where the problem is. It wouldn't affect, you know, a large number of children, but it might affect a certain number. So if you've got a concern about a particular child because of diet, health, medication, and so on, then that might be a reason to explore it and look at it further. But otherwise, generally, it wouldn't be a normal thing to, I think, regularly screen children for osteoporosis. If that answers the question. Yeah, I know it's worrying. People do worry about what's going on with their children and why this happens and that happens. But, you know, I mean, I know we're talking about osteoporosis, but it's just a matter of keeping a sort of even, you know, it's easy to focus everything in one conversation and suddenly everybody's got a particular case, you know, condition. So, yeah. But luckily, I think that's not a big issue.
I have a question. I want to,
Sure.
please, can you explain the difference between vitamin D2 and D3?
Okay. Well, again, I'm not an expert on vitamins so much as the fact that there are different branches, if you like, of the chemistry of how vitamins work. And vitamin B, as you know, has got various different versions as well. It's all about having a balanced diet that incorporates the different bits of these vitamins. So it could be, with a very detailed analysis, chemical analysis, someone could work out exactly what you're missing. But to be honest, that might be too much detail, and sometimes taking the general D vitamin or with a mix of different components might be completely adequate. So that might be perhaps too much detail for the average person to go to and explore. So it might be quite fine to go on.
Sorry, my question was vitamin D2 and D3. Yeah, difference between them.
Right. Okay. To be honest with you, I mean, that detail on that topic is not an area which I would delve into in great depth.
Can I say something? I think the difference between D2 and D3 is that D3 is a little bit more effective than D2.
Well, I wouldn't like to say, and it depends what a particular person is missing as to what they need. And I don't know whether for example, over the counter, I imagine that what I've certainly looked into is that most of them are a mixed vitamin D or a mixed vitamin B mix of vitamins. So, you know, in a sense, you know, I mean, it possibly in some foods, there's for example, and again, I can't give you the examples right off the top of my head, but there may be certain foods that have got more D1 or D2 in, like there is more B12 in some things and more, you know, B6 in other things. So it depends. It really is. So from the natural point of view, you might find these vitamins are different in different food types, whereas it's different when it comes to supplements.
Thank you.
If that helps.
I just want to ask, if you don't take, like you have menopause, but you don't take any hormone replacement, but you got a healthy diet, would you be still at risk of osteoporosis?
Yeah, you could still be at risk, because if the hormones are not making the bone cells create more bone, you could take the supplements and much is happening. But there are a number of other conditions which can cause what's called osteopenia, where the cells are not working properly and in low numbers, and also their activation is low. And you can also have, you know, so you could be eating plenty of the right things, but your body is not actually turning them into quality bone. So that can be, some people do go on a low dose of HRT. And again, on the Royal Osteoporosis Society website, there's a section specifically on hormone replacement therapy, its pros and cons, but the risk of it for other health conditions in women is also there, you know, and certainly people with various cancers need to avoid any such treatment. So it's sort of gone in and out of popularity to take HRT. Some years ago, a lot of women I was treating were saying they're on HRT, and these days, very few, relatively. But for the certain case where there's a serious problem, it might be some HRT for a period of time might be the right thing for you, but you know, that might be a decision your GP makes with you.
Yeah, I just want to say, you were talking about vitamin D, which we can have various symptoms. That's why I always say it's best to see the GP, because I used to have pain on my knees and my ankle to the point where I've fallen in the street, and my knees, my right knee was really hurting me. And I was sent to have an MRI, and finally there was nothing wrong. Then the blood test showed I was extremely low with vitamin D, and that's what causes. So like you said, it can be varied in symptom, how the vitamin D can show, basically. I was shocked when I was...
Yeah, well, it is variable, and it's not necessarily the case that the vitamin D had anything to do with your knee pain either, potentially.
I was told that it was vitamin D. That's why I was having these pains.
Okay, well, it may be the case. It may be the case, but obviously with all these things, it's often a bit of a clouded issue as to what causes what. And by the time you get all the tests and you get reviewed and then you get seen again, some months have passed and things have changed. And so sometimes it's very hard to pinpoint exactly you know, two things that correlate exactly together of cause and effect. And that's a really, that's always in medicine a really difficult thing. So,
but I can tell you for sure that the fact that I exercise help a lot. I don't feel any more pain. I've been doing exercise every single day, and it's really, really, I advise that because it does help in all sense.
Yeah. In general terms, exercise is good, and what we do is stimulate people to keep exercising, because at the end of the day, self-care is something you can do every day. You know, going to see a health professional now and again for some direction and signposting is what's useful, and some advice, and then you need to carry out the action. Not everybody finds it as easy to be, well, you're a great group together, champions supporting the community. Well, that's something perhaps if we may end up on, I think, Kimberly, is that the whole point about having people who've had life experience, who have got, you know, a voice, who can ask questions, who can stand up for people, who can do all the things you guys are doing and find out information for the members and for other people in the community, is what's really important, because it's not so easy to put across all of the things we've talked about today to everybody out there. You know, you need people, champions, to help people literally digest the information and to make the best decisions and best choices. And that, I think, is a really, you know, that's great. And why I'm delighted to do, you know, today's little chat, because you've obviously, I've had the written questions and I've had lots of other questions today. It's always difficult to be, can I say, directly personal about a particular medical case that any of you may have got, but I think the questions you've asked, and hopefully where I've answered them, has been reasonably helpful. Do tell me, but to sort of open the mind and explore things in different ways. So I hope we've achieved the goal, Kimberly.
Can I ask a question, please?
Sure.
Hello.
Hello.
Yes. How would you advise a lady who's pregnant if she's got osteoporosis?
Okay. Well, again,
what would you suggest?
Well, keeping exercise. If we're talking maternity, I mean, this is perhaps another whole chat, which I would prefer to do another time and have the topic happily for the whole time. But keeping mobile, keeping active, we know. Preparing for pregnancy is really important as well. And the problem is, you know, some people prepare, some people don't. But keeping active and healthy and fit to have your body in the right state beforehand, if you can, is really useful. Obviously, there are going to be certain things and certain supplements we know that you may not wish to take. And again, all of those blood tests and checking vitamins and all the other levels can be done as a normal part of pregnancy, or they should be, just to check that you're feeling healthy. There will be conditions specific to being pregnant, which include lots of different joint pains, ankle swelling, knee problems, hip problems, back problems. So there's going to be lots of different pains all over the place. Someone who's actually osteoporotic because of pregnancy, or was before the pregnancy, I mean, possibly the pregnancy is going to place a larger demand, obviously, on their body, and there could be a draw on their calcium levels as a result of the pregnancy, and that could amplify the osteoporosis. So again, you need to check with the GP if there's a risk, or a risk in the family, or other members of the family have been in the same situation. That might be something. But I think if someone's planning to get pregnant, then if there's a risk in the family, or they feel osteoporosis has been around for other members of the family, it might be worth checking that before getting pregnant, if that's an option.